Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. There's no ingredient more integral to the success of nicotine vaping products than flavors. There are thousands of flavors and flavor combinations on the market, and when using a nicotine vape to quit smoking or to stay quit, flavors provide endless opportunities to tailor the experience to personal taste. Simply, flavors are essential, and those who wish to eradicate vaping know it. That's why they push flavor bans and restrictions across North America. Joining us today to talk about the unintended consequences of flavor bans and restrictions is Dr. Michael Pesko, the J. Rhoads Foster Professor of Economics in the Department of Economics at the University of Missouri. He has published over 70 peer-reviewed papers, including over 20 on e-cigarette policy. He's the director of the Tobacco Online Policy Seminar, an international forum for research on tobacco policy, and he's also a member of the Canadian Scientific Advisory Board on vaping products. Dr. Pesko, thanks for coming back on the show.
Good to be back.
Well, it's our pleasure. When we last had you on in November of 2021, it was to talk about the Biden administration's proposed excise tax on safer nicotine products and how it could drive millions of people back to smoking. Tell us, what happened to that tax?
Well, it didn't pass. The House of Representatives tried multiple times to include it in different iterations of spending packages that were occurring at the time. One of which did get passed, but the version that got passed did not include the e-cigarette tax. In general, the Senate was a lot more evenly divided between Democrats and Republicans, and there were a lot of moderates that did not support the e-cigarette tax, and so that helped to kill it.
Now, the impetus for the tax was the concern over the rapid rise in teen vaping, correct?
Well, you never know. I mean, I don't know if we can. I mean, I think policymakers, legislators certainly said that, right? But certainly, e-cigarette taxes, there could be a revenue consideration as well with any kind of taxation, right? And policymakers might just be trying to find ways to raise revenue, right? But yeah, in general, that was a common concern raised by legislators when discussing the possible e-cigarette tax.
Now, with your work, what do you know in terms of the current status of teen vaping in the U.S.?
It's been continuing its decline from the height of it was around 2019. And there were some surveys in the United States that found, I think, close to 30% of teens had tried an e-cigarette over the past 30 days. It's a little bit misleading because very few of these teens were regularly using, like 2 and 3 of that 30% were using just 1 or 2 days over the past 30 days, right? So regular e-cigarette use was never nearly that high. But in general, all these rates have been declining since 2019. And meanwhile, cigarette use rates, which public health officials, track, and it's a very important outcome considering that combustible tobacco is, more dangerous than vape tobacco. That has fallen to levels where it's almost unmeasurable now among teens. And so that's a huge public health achievement that we've driven teen smoking rates to virtually zero.
Take a moment for us, please, to explain to our audience a little bit about your background in working in e-cigarette research.
I have a PhD in economics, and I've been involved with economics research as my whole career. There are a lot of economists that are studying natural experiments that are caused by policy changes. So the United States is well suited to analyzing these types of natural experiments, in Canada as well, given that a lot of tobacco policies done at the state level or done at the provincial level. And so, there are models that are capable then of if a state passes a certain policy, and we have data both before the policy passes and after the policy passes, and we have some states that did not pass the policy, we can identify what the effect of the policy change is. So, tobacco is, one kind of set of policies that there is a lot of policy variation. Obviously, it has important public health implications with I think top line figure close to 500,000 Americans die annually from smoking, which rivals the amount of people that died at the height of COVID per year. So clearly there's a lot of interest and need to know what effect do tobacco policies have in terms of reducing tobacco-related mortality and other types of morbidity. That's how I got kind of into it, I guess. I mean, it seemed like an important area of research, and it's well set up for evaluation using economics methods. And so my work has been funded then by the National Institute on Drug Abuse of the National Institutes of Health. So these institutes and organizations, they have a need to know what's going on here and rely on credible evaluations to tell them.
Now, you've done an enormous amount of work, very important work on the impact of e-cigarette taxes, including this December of 2022 paper titled The Effects of E-Cigarette Taxes on E-Cigarette Prices and Tobacco Product Sales. Dr. Pesko, let's dive into the tax issue before we tackle flavors. Do e-cigarette taxes drive people back to smoking?
Well, I suspect yes. I mean, in general, you're identifying one very particular mechanism, I think, of people being smokers, and then at some point they changed from smoking to e-cigarettes, which a lot of people do, right? And then the e-cigarette tax was the thing that pushed them back to smoking, right? So certainly that is likely going on, right? But there could be other mechanisms as well, right? Like, for example, the e-cigarette tax might have prevented people that would have otherwise quit smoking from ever trying to quit in the first place, right? So there could be these counterfactual smokers that at some point they would have finally reached for that e-cigarette and given it a shot, right? But taxes are too high now on that e-cigarette, right? Maybe in some states, e-cigarette taxes are higher than cigarette taxes, right? So especially for those individuals, they wouldn't have an incentive then a financial incentive, at least to try to quit with an e-cigarette, right? So that could be going on. And then, another mechanism, then obviously thinking about the youth angle, right? I mean, the e-cigarettes, and this is what I think is going on, right? We see teen cigarette use rates plummeting, and we see e-cigarette use rates, that increased, although they're stabilizing now, right? But basically, a lot of teens are using e-cigarettes instead of smoking. And I think that is if e-cigarettes are, say, a third of the risk of combustible tobacco, that's a huge public health achievement, right? If we can switch people from using a more dangerous form of tobacco to a less dangerous form, right? And so the e-cigarette taxes, I guess they could be, maybe a lot of these teens are using e-cigarettes because they're less expensive. And so if we tax them, these teens, they might just jump right into smoking instead, right? So all of these things could be going on, right, as a result of e-cigarette taxes that basically raise population level cigarette use rates. And it's difficult to disentangle, which populations are being affected. But I suspect, and there's evidence to support that all those mechanisms are occurring.
Now, in terms of the U.S., have quite a few states enacted e-cigarette taxes?
My last I looked, there were 30 states that have e-cigarette taxes. There's no federal e-cigarette tax currently, as we talked about previously.
What are the main drivers? Are e-cigarettes elastic or inelastic? Maybe explain that for our viewers.
Yes, there is evidence from the paper that you cited earlier that e-cigarettes are very elastic. So that means that as if the price increases by, say, 10%, then we would expect greater than 10% reductions in e-cigarette sales, right? And actually, we find a 22% reduction in e-cigarette sales due to a 10% increase in e-cigarette prices in that particular paper. And then, of course, then there's substitution, economic substitution as well. Then, and we might be interested in knowing, well, what effect do the e-cigarette taxes then have on cigarette sales, right? And our top line number there is that a 10% increase in e-cigarette prices leads to a 40 4.3% increase in cigarette sales, suggesting that they're economic substitutes.
This always puzzles me so much because tobacco control, if there's anything that they know best, is the impact of wielding taxes on tobacco, combustible tobacco, in order to force people out of that product. So, when they put, e-cigarette taxes on and raise them, is it unintended consequence that there's more smoking in substitution, or is it intended?
There's both an intended and unintended effect. Right. I mean, if taken at assuming that the goal of the tax is to reduce e-cigarette sales or use, right, versus other goals like raising revenue, right? But assuming that that's the intended goal, then the e-cigarette tax is working as intended in terms of reducing e-cigarette sales and use, right? But the unintended effect then is the increase, right, in cigarette sales and use. I think that there's kind of a misperception maybe within the tobacco control community that tobacco taxes are always effective, and they're the most effective policy that we have, one of the most effective policy tools that we have to reduce tobacco use, but that kind of conclusion was based on a marketplace in which we only had cigarettes, right? And now we have all these reduced risk tobacco products, and we can't necessarily apply the same logic to these other products, because it could be causing substitution to the more harmful products.
Dr. Pesko, how would you characterize your professional opinion on e-cigarettes?
Well, I think that they're a reduced risk product, right? Than combustible tobacco. They're not a safe product, but they are substantially less risky. The number that I have seen in when experts were surveyed on this question of, what is the relative risk of e-cigarettes versus cigarettes? And by experts, I mean people that have published before, so maybe are a little more knowledgeable about these kinds of questions than your general public. And they suggest about 33% of the risks of cigarettes is e-cigarettes. So I guess on one level, then it's something to be hopeful about, right? If we could have just taken all of the combustible tobacco users, taken away their cigarettes and given them an e-cigarette instead, right? We would be talking about 66% reduction in tobacco-related mortality in a year, right? That would be a huge public health achievement, right? Among kids, they kind of reacted very quickly to the e-cigarettes, and they started making that transition early, right? Among adults that are a little bit more, hardened in their preferences and have been smoking for a long time, they're a little less likely, I think, to give e-cigarettes a try, and maybe they're a little more addicted to cigarettes, and so the e-cigarettes aren't as effective for them. But in general, we're starting to see adult cigarette use rates declining rapidly as well. So these are all things I think to be really, really hopeful about. And then, of course, I should also mention, I think, other tobacco products, nicotine products like nicotine pouches, for example, right, that are sold in the United States. And these have even less risk than e-cigarettes. And so that could represent another opportunity as well to reduce tobacco-related disease and death by trying to encourage substitution to an even safer product, which could be nicotine pouches.
Everything you're talking about here falls under the principle of tobacco harm reduction. Do you think that is something that's being taken up by public health in the U.S.?
I don't think so. No. I think that in general, the approach that I see in the United States and I see worldwide, really, absent a few countries, is I think that it's easier to get political wins on newer products because the lobbies are less entrenched. It's easier. It's easier for public health officials to work with government leaders and honestly to work with the cigarette industry as well. that doesn't want new products on the marketplace because these are going to cannibalize their existing sales, right? So you get a Baptist and bootleggers style alliance, right? With public health officials and with the cigarette industry going to talk to government officials about, hey, there's this new upshot product here. Government officials, it's relatively easy for them to regulate it because they're so new and they haven't entrenched themselves. And so I think that, yeah, a lot of public health officials, they feel good when they can do something. But unfortunately, a lot of the things that they're doing are things that are making the situation worse on a population level. There might be some benefit maybe to some kids, right, that don't use these products otherwise, right? But that any benefit that has is small compared to the lost opportunity to help adult smokers by providing them with safer tobacco products that are less likely to lead to disease and death.
So if I heard that correctly, you're saying that public health officials in the U.S., their approach to regulating nicotine vaping products is one that's making at a population level things worse off for people.
Yeah, that's my opinion.
How do your colleagues think of that? The ones that might be a bit critical of your research?
Well, I don't think that I think that it's pretty well established that, there's substitution, right, between combustible tobacco and e-cigarettes. I've done some of that research. Other people have done that research, right? It's a pretty consistent pattern of results. And honestly, it's not that surprising, right? I mean, if we think about it, if there are 10 different, nicotine products, on the market, right, and we substantially reduce one of them, right, e-cigarettes in that case, right, there's going to be some people that are going to leave the nicotine marketplace altogether, right, but there's going to be other people that stay in the nicotine marketplace and they use any of the other 9 products that are there, right, and that's what economic substitution is. So, to pretend that somehow we can regulate one of those products and that's going to take away people from all the other products as well, right? Like that's kind of a fantasy, right? So in that sense, I don't think it's really that surprising, and I don't think people really even consider it that controversial.
Dr. Pesko, how important are flavors to the tobacco harm reduction effort?
Well, I don't know if I have a lot of precise information on that question. But I do know that it does seem like if you restrict flavors from e-cigarettes, you see sharp reductions in their sales, right? And I also know that when you do that, you see sharp increases then in cigarette sales, including brands disproportionately used by youth. So that suggests to me that the marketplace values flavors. And so it seems like if people are using, these sales reductions that we document, if this is including, a lot of adults that are using e-cigarettes that would otherwise be smoking, then the implications are that it would be having an adverse public health outcome.
Dr. Pesko, in the U.S., we know several states have banned flavors, including California. How prominent is this tactic in the United States?
Well, at last count, there are 375 localities, 7 states in Washington, D.C., that have restricted non-menthol flavored e-cigarette sales. They
are quite the fashion right now, aren't they?
Yeah, that seems to be. I hear more talk about the flavor restrictions than taxes at the moment, for better or worse. But maybe people are responding to our research on some levels, because we have been repeatedly warning about the taxes and the e-cigarette taxes and the adverse consequences. And so maybe some of these public health groups are shifting towards flavor restrictions instead.
Now, just last month, a major paper released titled The Unintended Consequences of Vaping Flavor Restrictions, which you co-authored with Abigail Friedman and Alyssa Crippen from the Yale School of Public Health. along with Alex Lieber from the Lombardi Comprehensive Cancer Center at Georgetown University. It's a multidisciplinary study that merges health policy, oncology, and economics to study vaping flavor restrictions. Dr. Pesko, I know you just mentioned it, but please dive back into those main findings.
Yeah, well, we looked to study the effect of the ENDS flavor restrictions in those localities that I mentioned, 375 localities, 7 states, Washington, D.C. We used sales data from 2018 through early 2023. So we have very recent data. We know the volume of e-cigarette liquids sold in these different states. We know the number of cigarettes sold in these different states. And so we set up our traditional kind of difference in difference style regression model and find that, the e-cigarette flavor restrictions led to sharp reductions in e-cigarette sales. And they also increased cigarette sales, including for brands disproportionately used by youth.
Now, that's the shocking thing, isn't it? Or am I missing something there? Flavor bans increase smoking.
Yeah. And so they operate, it's very similar in findings to, e-cigarette taxes, right? I mean, I think that, before I did e-cigarette tax work, I did a lot of work on minimum legal sales age laws, and we found the same thing there, right? I mean, whenever, and maybe not really surprising, to kind of go back to my last analogy about the 10 different nicotine products, right? And you regulate one, and there's going to be some people leave the nicotine market, other people substitute to the remaining 9 available, right? I mean, whether it's a minimum legal sales age law, whether it's a tax, whether it's a flavor restriction, I mean, whenever you restrict access, right, or kind of appeal of one nicotine product, there's going to be some people leaving the nicotine marketplace and other people shifting to other tobacco products, right? And unfortunately, the other e-cigarettes is one of the safer ones, right? So then when people shift, it's causing increases in more harmful ones, right? So if we want to take it, we should be taking advantage of this. We should be being more aggressive with the more dangerous products, right? And then causing some shift to the safer products, right? But the danger of kind of a aggressive kind of focus on e-cigarettes and other kind of novel, low-risk tobacco products recently, right, is the consequences of that are, a lot of people not changing from the cigarette to the safer product when they otherwise would do so, kids using combustibles rather than the safer product that would otherwise be available.
Now, and that's obviously what's concerning to everybody. But the fact is that these flavor bans are coming into the marketplace in order to protect teens. At least that's ostensibly what the promise is. And so we know that Abigail Friedman, your colleague, had done some of the early research on flavor bans. And I think in California, where it was shockingly San Francisco, that showed that these flavor bans, lead to an increase in teen smoking. What is the disconnect here with public health?
I was just talking to a physician about this actually, and with the disconnect, I mean, so I walked through all of these, I shared the new study with her. I talked about some other stuff we have in the work that finds similar, findings. And her response is like, well, yeah, but kids, they use flavored, like we know that kids use flavored products, right? And so she's thinking that if we restrict flavors from e-cigarettes, kids won't use e-cigarettes, right? That might be true on some level, right? But a lot of kids, they'll just substitute to, legally available flavors, menthol or unflavored e-cigarettes, right? So it's not like every teen using a flavored product, you're going to get them to leave the e-cigarette marketplace, right? And then further, I mean, the teens that I guess do leave the e-cigarette marketplace, right? Some of them are going to go on, they're going to smoke instead, right? And so that's not good, right? And so I don't know, I think it's kind of easy to, it's probably easy for public health groups when they talk to legislators, right? To just say, hey, 80% of teens that use e-cigarettes, they use flavors, right? And, I don't know if people are thinking that very, very hard about, counterfactuals and, what would happen if we took the flavors away? Is that, like, are we talking about causal relationships here? Are we talking about correlational relationships, that kind of thing?
So in the paper, here's a quote: "The data reveals a concerning trend for every decrease in the sale of a 0.7 ml ENDS product," which is, e-cigarette cartridge, "due to flavor restrictions, there's an increase in the sale of 15 traditional cigarettes." So what does that mean? And can you extrapolate that into some wider number if we know that there was a flavor ban in California for the last X number of years? Could we actually say guesstimate how many extra cigarettes were sold as a result?
So that number it's based on the national, population, right? So I guess like if we wanted to extrapolate it down to like a specific, city or state, right? I guess usually we go the other way around, right? Usually we take estimates from like cities or states and we extrapolate up to the national level. In this case, we're trying to extrapolate down. I mean, if the populations are generalizable, I think you can, right? And I think you would need to know then something about like how, what was the reduction then in e-cigarette sales, right? Because it's, there's going to be sharp reductions in flavors, right? But then there's increases then in unflavored e-cigarette sales and mentholated e-cigarette sales as well, right? So what is the net effect, on e-cigarette sales? But then in theory, then if you know a net effect and what the net reduction is, then you can multiply, that that 0.7 fluid milliliter quantity by 15 cigarettes to see what the anticipated effect is on cigarette sales.
It can't be very good, or good if you're in the business of selling combustible cigarettes.
Of course. And I mean, I think that's why I was referring to the Baptist and Bootleggers, Alliance before, right? I mean, I think the traditional cigarette industry, in different places of the world, I think they're more, they can get away with more of this kind of stuff, right? I think in the United States, as far as I think they're pretty quiet, and I think that they just kind of know, like a lot of these public health groups in many ways just kind of go do our bidding for us, right? So why even weigh in, right? When you have public health groups that, are willing to, attack your competitors, right? I mean, what a dream situation, right? In other parts of the world, I think they're a little more aggressive in terms of trying to network with, different groups to get regulations to make it, in a lot of countries of the world, e-cigarettes are banned, right? I know that there's a lot of aggressive efforts, including in the European Union currently, to get nicotine pouches banned, right? I mean, nicotine pouches have about the same level of risk as nicotine gum, right? And so, why are we focused on that? Meanwhile, cigarettes continue to be sold, right? And are available basically anywhere, right? But there's just not, political will, and there's not the lobbying apparatus to go after the cigarette industry. And instead, it's, a lot easier for these interests to focus on things that they can affect, even if there's adverse public health outcomes as a result.
In this flavor research you and your colleagues did, you looked at all age groups, right? So it's not just teens, but adults too as well?
It's sales data, right? So anybody purchasing, and we don't know, who's doing the purchasing, right? But we do explore heterogeneity a little bit based on the fact that we can use survey data, and we know that some brands are disproportionately used by young adults, teenagers. Other brands are disproportionately used by older adults, right? So there's some heterogeneity along those dimensions, right? And so then in the sales data, we have breakdowns by brand, right? And so then we can see, when these flavor restrictions come into place, what effect is there on this brand that is used by older adults? What effect is there on this brand that's used by younger people, right? We find increases across all of the different age, the different brands preferred by different groups based on age.
Were illicit products such as disposables factored into the study?
Yeah, disposables are included. Any tobacco product that's sold in one of the stores that's tracked by our data. We do miss. We don't have vape shops in our data, so that's a limitation. And that's a limitation of a lot of the sales based data sources, and that we're basically studying what effect is there in convenience stores, right? Or gas stations, that kind of thing. It's really hard to figure out where do we get information on what's going on in vape shops, right? But that would that's an area of research interest of mine that I'm hoping to find a way to identify vape shop sales in the future and look at these in future research projects.
Let me ask you, Dr. Pesko, has there been any acknowledgement from regulators, FDA Center for Tobacco Products, for instance, or any state public health authority? Has there been any response to the findings from this paper?
I haven't heard anything. Haven't heard anything. I mean, we try to publicize, these studies, in media in general. They're not interested. I haven't heard. Yeah, I haven't heard anything.
So the media that covers endlessly teens vaping and the rise in teen vaping won't cover this kind of news.
Yeah, I think that's right. Yeah, it's just not. There's very little interest in tobacco harm reduction. Unfortunately, I've learned, it's just easier for people to just kind of focus on. We don't like new tobacco products. We don't like the idea of kids using tobacco and not really think that hard about it.
So is it fair to characterize the results of this flavor study as shocking?
To me, it doesn't seem surprising. Just going back to, what I've been saying. I mean, it's like, of course, if you have 10 different products in the nicotine marketplace, you regulate one of them, right? There's going to be people leaving that marketplace. There's going to be people substituting to the other 9, right? But I think that what's probably shocking to your typical American, right? In the sense that they've been told that, hey, this is an unambiguously good thing, restricting flavors from e-cigarettes. What can go wrong, right? And then to learn that there are, any policy, there's going to be both intended and unintended effects. And in this case, the unintended effect arguably is worse than any benefit of the policy, right? And so maybe that would be shocking to Americans, that there are policies that are passed, that there is research to suggest these are not going to be good for public health when they get passed anyways, right? So I think it's not the finding that's shocking. I think it's just more the environment that we're in that's shocking.